My name is Michael Awad, and I'm the Chief of Sleep Surgery and an Assistant Professor in the Department of Otolaryngology at Northwestern Medicine. So there are three main reasons that we treat sleep apnea. The most common is actually socially disruptive snoring that can disrupt a bed partner. The second is daytime effects of sleep apnea, including what we call cognitive deficits, so difficulty with concentration, memory, feeling excessively tired or fatigued during the day. And third are the long-term cardiovascular impacts. That is increased risks of things like strokes, heart attacks, high blood pressure, and also diabetes and early Alzheimer's disease or dementia. Upper airway stimulation is an FDA-approved treatment for sleep apnea that has been resistant to traditional medical therapies such as oral appliances or CPAP, which is essentially a mask attached to a small machine that will push air to keep you breathing while you're sleeping. Now, CPAP is a fantastic treatment, but in about 30 to 40% of cases, patients will not tolerate CPAP at 6 months to a year. And so for those patients, we need a more tailored approach in terms of available surgical treatment options. The procedure typically involves 3 incisions. We usually start with the neck incision. That's to find the nerves that control the tongue. And particularly, we want to parse out the fibers of the nerve that push the tongue forward. So we identify that nerve, we wrap a cuff around it, which is a stimulation lead. So that actually sends an electrical stimulation to push the tongue forward. Then the second part of the operation is to actually find the rib space, typically between the 4th and 5th rib spaces. We place a sensing lead there. That actually detects breathing. And then thirdly, we actually implant the pacemaker-like device itself. And that goes typically in the upper chest. We then connect all 3 of these pieces of the system and activate the device in the operating room and test the result. So the typical follow-up process is that the patient will come back at 1 week after surgery for a general wound check. During this period, we're just making sure that everything is settling down as we would hope. And then about 1 month after surgery, we look to activate the device. So the patient will come back into the clinic where we'll turn on the device and we will test a number of different stimulation levels to find what's comfortable for the patient. For patients who are suffering with medical therapies or traditionally have not had success, even remotely many years ago, as we know that many patients have abandoned previous medical therapies, there are new options available and there are even more options on the horizon. And so referring to a dedicated sleep team, such as our team at Northwestern Medicine, can help to open up those available options and aid physicians in achieving optimal health outcomes for their patients.